Today we're talking about the 5 sleeping positions to absolutely avoid and why. I'm Dr. Ammon Hills. I'm a pain management specialist practicing in northern Utah. I see a lot of people with chronic pain. A lot of these are sleep related. A lot of times people are coming in with neck pain, with shoulder pain, with back pain, pain at the elbow, the hands, the wrists. All of this can be related to sleep, so let's get into it. Number 1, let's talk about the neck, the cervical region. When we look at the neck, there is a natural curvature to the neck. We look straight on this way, as well as side to side, okay? Ears should be over the shoulder. The goal is to keep the neck in that position while you're sleeping. So let's talk about the first pitfall. We want to make sure the neck is in the neutral position. We don't want it leaning to one side because we have a small pillow here, okay? That's gonna put too much stress on the neck where it's not naturally aligned in the middle. Same thing if you have too much of a pillow, it's gonna put the neck in the opposite direction. If it's in that position for a long time throughout the night, then you're gonna have a kinked neck, very sore in the morning. Especially if you have any underlying arthritis where the space is already a little bit tight. If you have your neck in that position for a long time, you may wake up with even some numbness, some pain. And for you stomach sleepers, so if you're sleeping on your stomach, you may have some rotation in your neck, okay? You're either rotating it to the left or to the right when you're on your stomach. This may also put it at an unnatural, not in that neutral position where it may be best as far as helping with your pain. So if it's rotated to the side, again, if you have underlying arthritis, if you have other issues, this may put more stress on those nerves. Number 2, now we're talking about the shoulder, okay? When you're sleeping in a side lying position, it's important not to sleep directly over that shoulder. This can put a lot of stress on that shoulder joint. A helpful trick to avoid this pitfall is to bring the shoulder out a little bit to relieve the pressure, the direct pressure on the shoulder joint. Or just sleep on your back altogether. That relieves all the pressure coming from the shoulder joint. It's just I have some patients, they say I can't sleep unless I'm on my side. In those situations, if you have to be on your side, just bring the shoulder out a little bit to relieve some of that pressure. Number 3, elbow pain. So certain sleeping positions can worsen elbow pain, but not just elbow pain, numbness. So this is where we're getting into some of the nerves. So very common for people to sleep with their elbows up, right? Either up like this, to the side, elbows flexed. What's wrong with that? Well, if you're sleeping in that position all night long with your elbow flexed, that may put pressure on the funny bone nerve. So that nerve is called the ulnar nerve. That goes to the 4th and 5th fingers, so the little finger and the ring finger. You may wake up with some numbness there. You may feel like it's getting a little bit weaker if this has been going on for a long time. So the nerve can actually get a little bit squished or trapped at the elbow. This can lead to other problems depending how long it's going on for. If you don't correct this, which can be easily corrected with the correct sleeping position, you may need other treatments, including surgery, where we actually cut the skin right here and move the nerve, the transposition, to help relieve the pressure that it has. Easier to just fix your sleeping position right now. The next one are the wrists. So we talked about how people like to flex the elbows, but they also like to flex the wrists too, right? Sleeping in like a fetal position. So what this does is there's a little space in the wrist where there's 9 tendons that pass through that small space. A nerve passes through that same space. That space is called the carpal tunnel. When that nerve gets squished in that space, we call that carpal tunnel syndrome. You may get weakness with grip strength and also some numbness in that area as well. Some people, if they sleep all night like that and then they go to work all day typing with their wrists bent, not having good posture, then that can also exacerbate and lead to the breakdown of that nerve, leading to the numbness, to the pain, and to the tingling. Easy fix at night is sleeping with the wrists in a neutral position, right? Some people will even wear wrist splints that keep the wrist in a neutral position to help prevent that carpal tunnel from getting worse. If this is getting so bad where it's resulting in weakness and a lot of pain, not improving with some of the conservative treatments like bracing, then this is another surgery where people will actually cut the skin here to remove that compression around the nerve at the carpal tunnel to help you recover. These are so important to just fix now so you don't fall into these pitfalls. So next is the lumbar spine, so the low back. How do we fix the low back while you're sleeping? What is the pitfall? So a lot of times if you're laying on your side, for example, and you don't have anything in between your legs, then that's gonna put a little unnatural curvature in the spine. All of a sudden it's not in that natural position, and there's a little bit of bend or sway to the spine where it's not used to being in. This creates more pressure on the spine and will lead to sore back, low back pain. A common fix for this would be putting a pillow in between the legs. They have specialized pillows for this. They have like a Mackenzie night roll that you can put in between your legs or around your waist. Or you can just use a regular pillow. Just put that in between your legs to try to straighten out the natural curvature of your spine. The goal here is just to reduce the stress and the load on your spine as well as your joints. This may also be a factor if you have a really soft or not very well supported mattress. So remember, if it's been a while since you've replaced that mattress, you should be replacing it every 8 years, if not more, and may make a big difference in your chronic pain without having to do some of these other treatments. If you want to see more sleep videos, check out this one up here. Thanks for watching. Don't forget to subscribe, and we'll see you guys next time.